A 22-year-old man develops itchy red annular plaque with central clearing in right groin. KOH shows segmented hyphae. First-line oral drug? Terbinafine, 250 mg daily times 2 weeks, tinea cruris. Gray patch scalp ringworm in a child is most commonly caused by which organism in India? Microsporum auduini. Wood lamp shows coral red fluorescence in intertriginous lesions. Likely organism in therapy? Corynebacterium minicissimum, erythrasma. Treat with azithromycin or erythromycin. Cigarette paper scars after healing of flaccid bullae suggest which inherited blistering disorder? Epidermolysis bullosa acquisita. Target lesions with central dusky zone on palms after herpes reactivation indicates? Erythema multiforme minor. Stevens-Johnson syndrome involves 10% BSA detachment, drug most commonly implicated in Indian series? Nevirapine, with increasing ART use. Preferred systemic therapy for extensive plaque psoriasis unresponsive to methotrexate and PUVA? Secukinumab, IL-17A monoclonal. Tobacco brown macules on trunk that accentuate with sweat, spaghetti and meatball appearance on KOH. Diagnosis? Pityriasis versicolor, malassezia. Auspitz sign is due to removal of which histological layer exposing dermal papillae? Suprapapillary thinning in psoriasis, pinpoint bleeding. Childhood atopic dermatitis most commonly involves which body areas? Flexural surfaces, antecubital, popliteal fossae. Topical calcineurin inhibitor approved for facial atopic dermatitis to avoid steroid atrophy. Tacrolimus, 0.03% ointment. Itchy papules on forearms row along scratch lines. Koebner phenomenon classic of lichen planus. Wickham striae on violaceous papules are due to focal hypergranulosis of epidermis. Oral erosive lichen planus carries risk of malignant transformation into squamous cell carcinoma. Drug causing lichenoid eruption resembling idiopathic lichen planus? Hydroxychloroquine and beta blockers, except any. A newborn with erosions in areas of friction, Nikolsky negative, heals with milia. Likely diagnosis? Bullous impetigo, but milia suggests epidermolysis bullosa simplex. Answer: epidermolysis bullosa simplex. Most prognostic scoring system for toxic epidermal necrolysis? Scorton. Genes HLA-B1502 screening recommended before carbamazepine in which ethnic group? Southeast Asian Han Chinese. Inverse psoriasis affects which areas? Flexures, axillae, groins, inframammary, intergluteal. Dermatology Life Quality Index DLQI score equals C indicates severe impact. 10. Early translucent papule with telangiectasia on sun-exposed skin suggests basal cell carcinoma. Mohs micrographic surgery is especially indicated for BCC located on H. zone of face, periocular, nasal, periauricular. Cutaneous horn underlying malignancy most commonly, squamous cell carcinoma. Ugly duckling sign helps in early detection of which skin cancer? Malignant melanoma. Breslow thickness, more than 1 mm, warrants sentinel lymph node biopsy in melanoma. Rapidly growing vascular tumor in AIDS patient due to HHV8, Kaposi sarcoma. Ash leaf macules under wood lamp present since infancy suggest tuberous sclerosis complex. Café au lait spots with axillary freckles and Lisch nodules typical of neurofibromatosis type 1. Horny plug in dilated follicle on nose, closed comedone name. Whitehead. Adult female acne with hirsutism should be evaluated for androgen excess. First lab test, total serum testosterone/DHEAS. First-line systemic antibiotic for moderate papulopustular acne vulgaris, doxycycline, 100 mg BD. Isotretinoin teratogenicity mandates pregnancy test before starting in every months, 1 monthly. Pitted keratolysis causative organism type, Corynebacteria, Chytococcus sedentarius, gram-positive. Favus caused by trichophyton shown laney shows characteristic odor of mousy smell. Herald patch followed by Christmas tree distribution eruption, disease, pityriasis rosea. Common trigger preceding pityriasis rosea, viral infection, HHV6/7. In leprosy, loss of sensation earliest to disappear, fine touch, pain and temperature lost before deep touch, except pain and temperature first. Single skin lesion paucibacillary leprosy in child, WHO single-dose ROM regimen drugs, rifampicin, ofloxacin, minocycline. Type 1 lepra reaction managed with prednisolone 1 mg per kilogram. Ridley-Joplin classification, borderline tuberculoid leprosy skin smear index. Bacteriological index 0 to 1+, usually negative. Drug-resistant leprosy to dapsone, substitute drug in MDT, ofloxacin or minocycline. WHO uses clofazimine, rifampicin, and ofloxacin. AIDS patient with multiple non-itchy molluscum contagiosum large lesions, first-line therapy, cryotherapy/curettage, also heart. Dermatitis herpetiformis IgA deposits at dermal papillary tips on direct immunofluorescence. Drug of choice for dermatitis herpetiformis? Dapsone. IgA pemphigus variants target which desmosomal cadherin? Desmocolin 1. Positive Nikolsky sign seen in which autoimmune bullous disease? Pemphigus vulgaris. Pemphigus vulgaris antibody titer monitored by ELISA against which antigen? Desmoglein 3. Bullous pemphigoid target antigens BP180 and BP230. Porphyria cutanea tarda enzyme defect. Uroporphyrinogen decarboxylase. Screening test for Porphyria cutanea tarda. Urine wood lamp shows pink-orange fluorescence, uroporphyrin. Vitiligo universal over 80% BSA, first-line systemic therapy, oral mini-pulse dexamethasone. Skin type 4 vitiligo focal stable patch suitable surgical option? Punch grafting mini punch graft. Halo nevus center eventually develops spontaneous regression, central repigmentation, or atrophy. Melasma dermal type best treated with which laser? Low fluence Q-switched NDYAG 1064 nanometers. Infant with orange peel plaque on occiput, hairless. Lesion name? Nevus sebaceous of Jadasson. Sun-exposed dermis elastosis due to chronic UV termed solar elastosis, senile elastosis. Phrenoderma caused by deficiency of which vitamin? Vitamin A. Perioral dermatitis precipitated by chronic use of topical corticosteroids. Cutaneous adverse drug reaction morbilliform typically occurs after days of new drug, 7 to 14 days. Commonest drug causing fixed-dose combination of analgesic bullous FDE? NSAIDs, for example, ibuprofen. Men who have sex with men, painless genital ulcer, punched out with indurated edge. Organism? Treponema pallidum, chancre syphilis. Serological test that becomes negative after successful syphilis treatment? Non-treponemal tests, VDRL, RPR. Single-dose benzathine penicillin for early syphilis, million units IM, 2.4 million units. School of fish, gram stain pattern is characteristic of which STD pathogen? Haemophilus ducreyi, chancroid. Painful necrotizing genital ulcer with undermined edge and bubo suggests which STD? Chancroid. Lymphogranuloma venereum caused by which chlamydia cerevars? L1, L2, L3. Granuloma inguinal tissue smear shows Donovan bodies which are intracytoplasmic safety pin bipolar staining bacteria, Klebsiella granulomatis. Most sensitive test for HSV-2 genital ulcer? PCR for HSV DNA. HPV types associated with high-grade cervical intraepithelial neoplasia, 16 and 18. Gardasil 9 vaccine schedule for a 14-year-old girl, 2 doses at 0 and 6 to 12 months. Pearly penile papules are considered a normal variant arising from which structure? Corona of glands, angiofibromas. Hidradenitis suppurativa pathogenesis begins with occlusion of follicular infundibulum, apocrine involvement secondary. Early stage 3 HS treatment of choice, wide surgical excision with secondary intention healing. Linear IgA bullous dermatosis, first-line drug in children, dapsone. Dermatomyositis pathognomonic violet papule over knuckles called Gottron papule. Heliotrope rash in dermatomyositis appears on upper eyelids. Koebner phenomenon not seen in which? Psoriasis, lichen planus, vitiligo, pemphigus, 400 rec milliseconds, pemphigus vulgaris. Nikolsky sign negative but bulla roof thick. Which disorder? Bullous pemphigoid. Dermatitis artifacta should raise suspicion of underlying psychiatric disorder, factitious. Cutaneous drug eruption with targetoid lesions plus mucosal involvement greater than 10% BSA called Stevens-Johnson syndrome. 10 mortality predictor scortin includes which lab parameter? 10 millimoles per liter. Serum bicarbonate 20 millimoles per liter. Actually, scortin uses HCO3 20. Honey-colored crusted papules on child's face. Pathogen? Staphylococcus aureus, impetigo contagiosa. Erysipelas versus cellulitis distinguished by raised sharp demarcated edge in erysipelas. Interdigital maceration athlete foot due to which dermatophyte in India? Trichophyton rubrum. Trichophyton tonsurans causes which type of tinea candidus? Black dot endothrix. Sporotrichoid nodular lymphangitis classically due to which dimorphic fungus? Sporothrix schenki. Chromoblastomycosis, sclerotic bodies in KOH known as medlar bodies, copper pennies. Non-inflammatory comedonal acne, first-line topical agent, adapalene 0.1%. Hyperhidrosis palmar managed long-term with which iontophoresis solution? Tapwater iontophoresis or glycopyrrolate? Infantile hemangioma, alarming if segmental facial due to association with face syndrome. Nevus of Oda affects which branch of trigeminal nerve distribution? First and second, V1, V2. Spaghetti and meatballs appearance refers to yeast and short hyphae of Malassezia furfur. Nail pitting is most characteristic of psoriasis. Though lines represent temporary arrest of nail growth after systemic illness, high fever. Dermoscopic comma hairs diagnostic clue of tinea capitis. Most common photodermatosis in Indian skin? Polymorphous light eruption. Minimum erythema dose, MED, measures skin sensitivity to UVB radiation. Acrodermatitis enteropathica due to malabsorption of which micronutrient? Zinc. Nikolsky positive superficial vesicles in neonate but culture sterile. Diagnosis? Staphylococcal scalded skin syndrome. Topical 5-fluorouracil 5% cream approved indication in dermatology? Actinic keratosis, also superficial BCC.